The fluorescent lights hummed overhead like a nest of hornets, their white-blue glow turning everything the color of surrender. Cedar Creek Medical's night shift moved in whispers, nurses changing shifts, monitors beeping their lonely metronome, the distant hiss of ventilators keeping people tethered to the world. Sarah Chen walked through the hallways at 11:06 p.m. the way water moves through a river, present but unremarkable, part of the system but not of it. Her scrubs were navy blue, unmarked except for a single badge that read RN with no photo, no personality, no history. She preferred it that way. The badge clattered softly against her ribs as she moved toward the trauma bay, and the sound, metal on bone, was the only announcement she made. Her hands were steady. Always. That was the thing about Sarah Chen that nobody noticed because nobody looked close enough. The scars that laced her knuckles and the thin white line that traced her left forearm were just part of the landscape of a working nurse. Work injury, they assumed. Hospital nurse for 17 years. Minor surgery scar, probably. Nobody assumed anything else. Nobody asked. The night shift attracted people who didn't want questions, and Sarah Chen had perfected the art of the unremarkable. She moved through the hospital like a shadow that had learned to fold sutures. At 11:52 p.m., the ambulance radio crackled, incoming pediatric trauma, car versus sedan, 8-year-old, unconscious on scene, significant abdominal bleeding, ETA for minutes. Sarah heard it the same way she heard most things, noted it, filed it, continued moving. She was prepping a room on the surgical wing when the paramedics brought the boy in on a stretcher, his small body already invaded by lines and oxygen, his chest rising and falling with mechanical help. His name was Marcus Bradley. His father, a man with gray at his temples and the particular way of standing that came from years of command, followed behind like a planet pulled into orbit by a star he couldn't protect. Major David Bradley. Special Forces. Sarah recognized the bearing before she saw the patch on his jacket, that terrible, unmistakable posture of a man trained to control everything suddenly confronted with something he couldn't. The 5 doctors arrived like a committee, moving through the hallway with the kind of confidence that came from having answers. Dr. Prescott led them, tall, silver-haired, the kind of physician whose name was on a building somewhere, whose wife sat on the hospital foundation board. Behind him came Dr. Hammond, heavyset and frowning, then Dr. Reeves with her tablet already pulled up, Dr. Castellano scrolling through something on his phone, and finally Dr. Yoon, the junior resident, trailing behind like a student who hadn't been invited but showed up anyway. They didn't acknowledge Sarah as she moved past them into the trauma bay. She was just the night nurse. Invisible. Exactly what she wanted. She heard their voices from the hallway, the closed-door conversation happening in the consultation room, their tones dropping into that particular register doctors used when they were about to tell a parent something that would fracture the world. She didn't move closer. She didn't need to. The fluorescent lights hummed, and she continued her work, checking monitors, scanning the surgical suite, organizing the instruments that might or might not be used depending on what 5 doctors decided in the next 6 minutes. The decision came at 12:08 a.m. Dr. Prescott walked back into the hallway with Major Bradley trailing behind him, and Sarah caught the exact moment when a father's face rearranged itself from hope into something closer to drowning. Prescott's voice was efficient, detached, the voice of a man discussing a quarterly report rather than the survival of someone's child. The internal bleeding is extensive. The trauma to the spleen, the liver, the degree of damage is inconsistent with a successful surgical outcome. Add to that the communication barriers. Your son is deaf, correct? Post-operative care becomes significantly complicated. Monitoring for pain responsiveness, communicating critical instructions, ensuring compliance with recovery protocols. The complications compound the risks. In our professional assessment, comfort measures represent the most humane course of action. Comfort measures. The phrase hung in the fluorescent lit air like something toxic. Sarah's hands didn't shake. They never did. She watched Major Bradley's chest heave as if he was drowning, watched the exact moment when understanding tried to settle into his body, watched him say something she couldn't hear, watched Prescott place a hand on his shoulder with the kind of practiced sympathy that probably took him 30 seconds to complete before moving on to the next patient, the next decision, the next dismissal. That was when Sarah saw it. Prescott's hand moved to his jacket pocket, a smooth, practiced motion, and the blue plastic of an EpiPen auto-injector disappeared into fabric. Standard procedure would have been documentation. Standard protocol meant storage in the medication room, logged, tracked, accounted for. Instead, Sarah watched it vanish, watched a doctor commit a small theft so casual, so practiced, that she realized this wasn't the first time. Her eyes didn't widen. Her breathing didn't change. But something in her spine went rigid, the way it had gone rigid at Bagram when she'd realized they were walking into an ambush. She knew something she wasn't supposed to know. The recognition of that fact was cold and clear and changed everything. Sarah returned to her locker at 1:14 a.m. during the quiet break that only night shift nurses understood, that pocket of time when the hospital held its breath, when the chaos paused just long enough to remember what silence felt like. The locker door opened smoothly, and she reached for the folded flag that rested on the shelf above her spare shoes, the one piece of her past that came with her every shift. It was small, compact, folded into that precise military triangle that meant someone had died and someone had grieved and someone, a family she'd served alongside in Kandahar province, had decided that Sarah Chen deserved to carry a piece of their loss forward. Her fingers traced the fold, and for just a moment, standing alone in the basement locker room with the smell of detergent and something else metallic hovering in the air, Sarah's composure did what it only did in complete solitude. It rested. She closed her eyes and remembered Bagram, and the field hospital, and the sound of her own voice giving orders through the chaos of rounds that never ended. Her hands had held people together there. People who wouldn't be alive without what she'd done. People who had died anyway. People whose families now sent her gifts wrapped in grief. She opened her eyes, placed the flag back on the shelf with the same care someone might place a holy relic, and closed the locker door. At 1:53 a.m., the night shift continued. Marcus Bradley slept the medicated sleep of a child about to be made comfortable. Major Bradley sat in the family waiting room and didn't move. Dr. Prescott had gone home. And Sarah Chen moved through the hallways, pushing a medication cart that clinked softly with each step, one shadow among many, one nurse among dozens, one person with 17 years of service and a medal buried in her past and eyes that saw far too much. She had learned long ago that seeing things was dangerous. That watching people do wrong things, that understanding their motives, that knowing what they'd hidden, that kind of knowing could cost you everything. She had learned to look away. She had learned to be quiet. She had learned to be invisible. But invisibility, she would soon discover, only worked if someone wasn't actively looking for a reason to make you visible. The morning briefing at Cedar Creek Medical started at 6:15. Sarah had already been working for hours, and the night shift nurses gathered in the conference room still wearing the ghosts of the previous 8 hours in their eyes. The fluorescent fixtures above cast everything in institutional white. Coffee sat in a thermal pot at the corner, bitter and cooling. Dr. Prescott entered like he owned the building. He probably thought he did. Tailored white coat, the kind that cost more than most nurses made in a week. His name, the real name, not the alias, was printed on a brass nameplate outside his office. The kind of nameplate that implied legacy. Old money. Medical school paid for before he was born. He set a stack of patient files on the conference table and smiled. Not a warm smile. The smile of a man who had already decided how this would go. "Sarah," he said, not looking at her. "I want to talk about pediatric pharmacology." She didn't respond. Sarah had learned that silence could be a shield. She simply waited, hands folded on the table in front of her. "Walk me through a 5-year-old with septic shock. Vancomycin dosing. Go." The room shifted. Other nurses exchanged glances. This wasn't a teaching moment. This was theater. Prescott was performing something for the attending physicians seated around the table, the ones who controlled schedules and recommendations and whether you stayed employed. "Vancomycin dosing in pediatric sepsis is weight-based," Sarah said, her voice steady and quiet. 15 to 20 milligrams per kilogram per dose, for every 6 to 8 hours. For a 5-year-old averaging 40 pounds, That's roughly 300 to 400 milligrams per dose. She delivered it like she'd memorized a textbook. Like she was just a nurse reciting information. She didn't mention that she'd calculated pediatric drug dosages in field hospitals under fire. That she'd pushed medications through combat lifesaver training that would make most ICU nurses dizzy just thinking about the responsibility. Prescott's jaw tightened. He didn't expect her to know. And what about volume of distribution in pediatric versus adult populations? His voice carried an edge now, a predator sensing weakness and discovering it wasn't there. Lower body fat percentage in children affects lipophilic drug distribution, Sarah continued. Water-soluble drugs distribute across a larger proportion of body weight. You adjust accordingly. Everyone in this room learned that in nursing school. The temperature in the conference room changed. Prescott's hand clenched against the table edge. Dr. Reeves, one of the attending physicians, almost smiled. Almost. But he caught himself and looked back at his notes. Community college, right? Prescott's voice was softer now, but the words came out like a knife. Raleigh Technical. That's what your file says. Silence. Sarah didn't flinch. Didn't blink. That was the cruelty of it. He was trying to diminish her by stating a fact, trying to make her previous answer seem impossible. The implication, how could someone from a community college program answer like that? That's correct, she said. Remarkable. He said it the way you'd comment on a clever dog performing a trick. Most of our night shift staff struggle with basics. You seem almost overqualified for pushing midnight labs. The other nurses looked at their coffee. Nobody else spoke. That was the power dynamic made visible. Prescott had institutional gravity. He pulled things toward him, promotions, board seats, recommendations. The night shift nurses orbited in his shadow, hoping not to collide. Sarah picked up her coffee cup. It was cold. She drank it anyway. The meeting ended at 6:47. Prescott had moved on to discussing patient census and staffing ratios, but everyone in that room understood the subtext. Sarah Chen was being marked. She was being noticed. And noticed was dangerous when you'd spent the last 7 years trying to be invisible. She made it to her shift assignment without incident. Pediatric ward, 3rd floor. She had Marcus Bradley on her roster that morning, the deaf 8-year-old whose father was Major Bradley, Special Forces, currently stationed 72 miles away at Fort Liberty. The boy was still sedated from the previous night's trauma. Still critical. Still without hope, according to 5 different doctors. Sarah checked his vitals. Heart rate 104. Respiratory rate 18. Oxygen saturation at 93%. The numbers told a story of a child hanging between two worlds, not quite stable, not yet critical. The ventilator wheezed its mechanical rhythm with each artificial breath. She was charting notes when the elevator dinged at the end of the corridor. Prescott stepped out and he was looking directly at her. Not the usual glance a physician gives a nurse. He was searching. His eyes tracked her from the supply station to the medication cart. Have a moment. His voice was pleasant. Casual. She shouldn't have gone. Some part of her, the part that still remembered bagram and decision trees and reading the angle of a man's shoulders before he moved, told her to decline. But that part was buried. She was supposed to be compliant. Supposed to be just a night shift nurse from community college who got lucky on a pharmacology question. The elevator doors opened. Prescott stepped inside. Sarah followed. He pressed the button for the ground floor, but then he moved. His right arm extended, blocking the closing doors from shutting. His body shifted to angle against the frame, and suddenly the small metal box of the elevator became smaller. Confined. The lights hummed a thin electronic frequency that made her teeth ache. I've been reviewing staffing patterns, he said. Night shift has been understaffed. I'm going to need to consolidate some responsibilities. I understand, Sarah said. 7 years of civilian life, and she still sounded deferential. Her voice had a softness to it that didn't match anything inside her. "Do you?" His eyes were on her now, and there was something predatory in the calculation. He was trying something. Testing. "Because I'm not sure you do." Night shift workers operate in a different environment. There are protocols, chains of command. Certain decisions that require day shift supervision. You stay in your lane, Sarah. You monitor, you document, you alert the attending. You don't make judgments. You don't intervene. You don't cross lines you're not qualified to cross. The elevator dinged. Ground floor. The door started to open behind his arm. "I understand," she said again. He smiled. Then he lowered his arm and stepped out, leaving her alone in the metal box as the doors hissed shut again. The elevator took her down further, to the basement level she hadn't requested, before grinding to a stop. She rode it back up. Her locker was in the basement break room. Blue metal door marked with her employee ID number. She'd kept it pristine for 7 years. No photos. No names. No anything that connected her to anyone or anywhere. When she opened it, the surface of the door bore new scratches. Deep ones. Deliberate. Night crawler. Someone had used something sharp, a key, probably, or the tip of a blade, to gouge the words into the paint. The letters were crude but forceful, each stroke carrying the weight of intention. She didn't move for 3 seconds. Her jaw tightened. That was the only tell. That single muscle contraction at the hinge of her mandible, visible only if someone was looking specifically for it. No one was looking. She was alone in the break room at 6:58 in the morning. She reached into the locker. Behind her street clothes, wrapped in a plastic bag to protect it from the humidity, was a folded flag. Not large. Not like the ones they use for funerals. This one was smaller, dirtier. It had been carried in a rucksack through Helmand Province. Through firefights in Sanjin Valley. Through a medevac flight where the woman holding it was bleeding through 7 layers of field dressing and still writing down the names of the soldiers she'd treated so their families would know. Her hand touched the flag without unfolding it. The fabric was cotton, aged. The weight of it was insignificant. The weight of what it meant was everything. She closed the locker door over it again, the scratched letters facing outward. Night crawler. That wasn't a name she'd earned in the military. That was a name someone had called her for staying awake, for watching, for seeing things that happened in darkness. It was a name that should have stayed buried in a classified debrief and a redacted report filed somewhere in the Pentagon basement. The night shift had given it to her again. That meant someone on day shift knew. Prescott knew. Or at least he suspected. And that meant the question changed from when would her past find her to what would happen first, when it did. Above her, in pediatrics, a child was dying because 5 doctors had decided his case was hopeless. And she had seen Prescott pocket the one thing that might have changed the outcome. The clock on the break room wall read 7:04. In exactly 17 hours, the shifts would change again, and the night staff would arrive. By then, something would have to give. The invisible woman who had lived so carefully, who had folded herself into scrubs and silence and the routine of midnight vitals, couldn't stay invisible anymore. Prescott had scratched her name into the metal. He had made her visible. And visible was about to become the most dangerous position at Cedar Creek Medical. The monitor flatlined at 2:06 a.m. One continuous tone. Then nothing. Marcus Bradley's small chest had stopped moving 43 seconds earlier. The on-call resident, Dr. Hammond's second-year fellow named Reeves, stood frozen beside the bed, his hands gripping the rail so hard his knuckles had gone translucent. His mouth opened. Closed. Opened again like a fish pulled onto dry dock, suffocating in air instead of water. "Get the crash cart," Sarah said. Not a question. A command. Reeves didn't move. The ventilator hissed its mechanical rhythm, indifferent to the boy's cardiac arrest. Sarah was already moving, muscle memory older than her nursing license carrying her toward the medication drawer. Bagram had taught her that hesitation costs lives. Panic costs lives. The only currency that matters is action. "Now, doctor," she said, and something in her voice, something that had nothing to do with the night shift at Cedar Creek Medical and everything to do with 4 years of field surgery under artillery fire, made Reeves stumble toward the crash cart like a man waking from a nightmare. Internal hemorrhage. Dr. Prescott had been right about that much. The car accident had torn through the child's spleen like shrapnel through Kevlar, and the blood had been pooling in his abdomen for hours while 5 doctors debated whether a deaf boy was worth the effort of surgical intervention. Now Marcus was in full cardiogenic shock, and the monitor showed a flat line that meant they were out of time. Sarah's hands moved steady as surgical steel as she opened the crash cart and pulled the emergency thoracotomy tray. The lights of Cedar Creek Medical seemed to sharpen around her, sounds crystallizing, the beep of the monitor, nothing, still nothing, the squeak of Reeves's shoes on tile, her own breathing, controlled and even. 1 milligram epi 4, she ordered. Now. Reeves pushed the medication. The monitor showed nothing. No response. Still nothing. 58 seconds since the flat line. In a combat hospital in Helmand Province, Sarah had learned that after 3 minutes without cardiac output, the brain begins dying. After 5 minutes, death becomes irreversible. They had maybe 220 seconds before Marcus Bradley became someone else's grief. "Defibrillator pads," Sarah said, and her voice had dropped an octave without her permission, carrying the weight of 100 field surgeries where the only thing between a soldier and a body bag was steady hands and the willingness to crack ribs if it meant saving a life. She pulled the boy's surgical gown away from his chest. Small. Too small. 8 years old was too small to be lying flat on a trauma bed with his heart refusing to beat. "Get the scalpel," she said. "Size 15. Now." Reeves stared at her like she'd spoken Pashto. "We need to. The surgeon is not here. The heart is not beating. The clock is running. I need the scalpel." It wasn't a request. It was a command, and something in her posture, the way she'd planted her feet, the way her shoulders had squared like someone stepping into a combat stance, made Reeves move without understanding why. The scalpel felt familiar in her hand. Too familiar. Cold stainless steel with a perfect edge, the kind of tool that separates living from dead. Sarah had used a combat knife in Bagram, improvising after a mortar strike had destroyed the surgical kit. She'd opened a Marine's chest at 3:38 a.m. in a compound 40 kilometers from the nearest hospital, her hands the only thing between him and exsanguination. 83 seconds. She pressed the scalpel to the space between Marcus's ribs, 4th and 5th intercostal space, and cut. The blade moved with the fluid precision of muscle memory, ignoring the part of her brain that screamed this was a child, this was Cedar Creek Medical, this was supposed to be a civilian nurse who followed protocols and raised her hand before speaking in meetings. Blood. A thin line of it, dark and urgent. "Rib retractor," she said, and Reeves actually moved this time, his hand shaking as he opened the boy's chest cavity wider. The lung tissue glistened under the overhead light, pale and deflated like something that had been waiting a very long time to see air again. 97 seconds. She could see the problem immediately. Spleen's hemorrhage had backed up through the vena cava, and the heart had stopped fighting. No cardiac output meant no oxygen delivery, meant no hope unless she fixed the bleeding. Sarah's hands moved into the cavity, fingers steady as instruments. She found the descending aorta and clamped it with a vascular clamp that Reeves somehow knew to place in her palm before she even asked. The bleeding slowed. Stopped. 104 seconds. "Epi again," she said. "Push 2 milligrams." Reeves pushed. The monitor flickered. 1 blip. Then flat line again. "Come on," Sarah whispered, and her hands were already moving toward the pericardium, the sac around the heart, because she'd seen this before in Bagram, cardiac tamponade from the internal bleeding, pressure crushing the heart itself so it couldn't pump even when the current was re-established. She opened the pericardium with surgical precision. Blood released like water from a broken dam, the accumulated pressure that had been suffocating the boy's heart. "Push another epi," she said. The monitor blipped. Twice. Then held. "Sinus rhythm." "We have a pulse," Reeves said, his voice cracking like he'd aged 5 years in the last 2 minutes. He was checking the carotid, finding what Sarah already knew: the child's heart was beating again. 88% O2 saturation. She needed to close, needed to get him to an operating theater where someone with credentials and a clear record could finish what muscle memory had started. But the bleeding had to stop first. Her hands moved in a running whip-stitch pattern she'd learned in a forward surgical team, a pattern so precise and efficient it looked like music, suturing the arterial damage with such speed and accuracy that Reeves's eyes widened like he was watching something he didn't have words for. The saturation climbed. 91%. 94%. 96%. The room had gone silent except for the monitor's steady beeping, the most beautiful sound in medicine, the sound of a child whose heart had decided to keep beating. Sarah completed the whip-stitch with a final knot, and her hands finally stopped moving. That's when she felt the stare. Captain Ellis. She didn't know his name yet, wouldn't know it for another 17 seconds, but she'd know that stare for the rest of her life. He was standing in the doorway in civilian clothes, jeans and a Walter Reed transfer jacket, and he was looking at her with the exact expression of someone who'd just watched a ghost walk out of the past. "I know that running whip-stitch," he said quietly, his voice like someone confirming a rumor that hadn't been spoken aloud in years. 4th Medical Battalion. Bagram? Sarah didn't turn around. She was already pulling off the surgical gloves, muscle memory transitioning to silence, the commander returning to the night shift nurse like stepping backward through a door. "Get him to the OR," she said to Reeves. "He needs a splenectomy. Tell the attending the aorta is clamped, someone's going to have to take over." "Wait," Ella said. "Commander." But Sarah was already walking, her gloved hands in a hazmat bin, her face betraying nothing except a slight clench of her jaw as she passed him without meeting his eyes. The folded flag from her fallen teammate's family was still in her locker, still waiting there like an artifact from a life she'd spent 3 years trying to bury under 12-hour shifts and a false name. What she didn't know was that Captain Ellis had made a call before following her to Cedar Creek Medical. And what she also didn't know was that the same colleague who'd whispered her code name in Bagram had been waiting for this moment since the day he heard she'd disappeared into the night shift. The phone in her pocket, the one she'd kept with a classified Pentagon line despite every protocol against it, was about to ring. By morning, the calls had already started. Dr. Prescott moved through Cedar Creek Medical like a man collecting debts, his voice precise and measured as he spoke to board members between 7 and 9 a.m. His golf buddy from the country club. The hospital CEO's poker partner. The chief of surgery who owed him a favor from a malpractice case he'd testified in back in 2019. Each call followed the same pattern: Sarah Chen had violated protocol. She had performed a surgical procedure without authorization. She had acted beyond her scope. The words came out smooth as oil on water, and by the time administration arrived at their desks, the narrative was already set. The hospital had no choice but to move. That was how Prescott had framed it, not as his demand, but as institutional necessity. By 9:15 a.m., 3 executives in press suits appeared at Cedar Creek's third-floor offices, and by 9:30, a suspension notice was being prepared. The language was careful, procedural, impeccable. Pending an external ethics investigation. Immediate suspension pending review. Her credentials would be flagged. Her references would be contacted. The process would take weeks, maybe months, and by then the damage would be done. Sarah wasn't in the hospital when the notice came down. She'd clocked out at 7 a.m., her shift finished, her scrubs folded in her locker. She didn't see the administrator trying to find her in the break room. She didn't see the way Dr. Prescott stood in the hallway with his arms crossed, watching the chaos like a man admiring his own handiwork. The calls to her references started at 10 a.m. The number she'd given for her previous employer in Nevada, a classified military medical facility, went to a Pentagon switchboard. "No comment," the operator said. All inquiries regarding Dr. Chen must be directed to the Department of Defense. The line went dead. The reference in Colorado, a trauma center where she'd supposedly worked for 2 years. I'm sorry, we're not able to discuss any former employees. Please submit your inquiry through our legal department. Prescott hung up. Both numbers redirected. Both blocked. Both unyielding. It was as if Sarah Chen had never existed in any of those places, as if her entire previous life was classified, sealed, beyond reach. That should have been his first warning. That should have been the moment Prescott realized he was standing on ground that wasn't as solid as he thought. But Prescott was a man accustomed to winning, accustomed to administrative victories, and he interpreted the silence as confirmation of something disreputable, an employee hiding a past, hiding failures, hiding reasons to be ashamed. He filed the suspension with greater confidence. By noon, it was official. Sarah was at Dempsey's Diner on Fayetteville Street when the administrator finally reached her by phone. The call came through at 12:22 p.m. Ms. Chen, this is Administrative Director Helen Caruso. We need you to come in and surrender your badge and credentials immediately. You're being placed on suspension pending investigation. Sarah didn't argue. She didn't ask questions. She simply said, I understand, and hung up the phone. The line went silent. She set the phone down on the laminate table and stared at her hands. They were clean. She'd scrubbed them the way she always did, but there was something beneath the surface that no amount of soap could reach. The diner around her was nearly empty. 2 truckers at the counter nursing weak coffee. An older woman in a corner booth reading yesterday's newspaper. The rain outside fell in sheets, hammering the windows with the rhythm of machine gun fire, and Sarah sat motionless, watching the water stream down the glass. She thought about calling someone. She had the number for a therapist the VA had recommended 3 years ago. She had the number for her sister in Atlanta, though she hadn't spoken to her in 8 months. She had the number for Captain Ellis at Walter Reed, but that number was a door she couldn't open, not now, not like this. Instead, she sat in the diner until 3 a.m. She watched the rain. She watched her reflection in the window, a woman in her early 40s, dark hair pulled back, face that could have belonged to anyone. A nurse. A civilian. A person rebuilding. She thought about what Prescott had said in the elevator, his arm blocking the door. Stay in your lane. Maybe he was right. Maybe the moment she'd picked up that scalpel, the moment she'd let muscle memory take over, she'd crossed a line she couldn't uncross. Maybe the quiet life she'd been building, the night shifts, the invisible existence, the careful anonymity, had all been an illusion. Maybe there was no such thing as a clean break from who you used to be. Her coffee had gone cold 2 hours ago. She stared at it. Around the diner, the neon hummed its electric song. Outside, the rain continued its percussion against the glass. She could leave Raleigh tonight. She could drive to another state, find another hospital, another night shift, another name. She could vanish again, the way she'd vanished after Bagram. She reached into her jacket pocket and pulled out a folded flag, the one her fallen teammate's family had given her 8 years ago. It was old now, the fabric soft from handling, the folds worn pale from where her fingers had touched it 1,000 times. She unfolded it slowly on the table. Red and white and blue, reduced to a small square of fabric in an empty diner at 3 in the morning. For a moment, her hand shook. It wasn't fear. It was something else, something her body remembered even when her mind was trying to forget. The trembling wasn't weakness. It was restraint. It was the difference between the woman she'd been and the woman she was trying to become, and the distance between them was about to collapse. The flag lay on the table like evidence. Like a confession. She was reaching to fold it again, to tuck it away, to make it disappear the way she'd been trying to make herself disappear, when the diner door swung open. Rain swept in with a gust of wind. A man stood in the doorway, his uniform soaked, his face carved with the kind of exhaustion that comes from sitting vigil in hospital chairs. It was Major Bradley. He held a folder in his hand, discharge papers, she would later learn. Behind him, visible through the rain-streaked glass of the diner, she could make out the shape of a car waiting in the parking lot. But his eyes were fixed on her, on the flag spread across the table in front of her, on the woman who'd saved his son's life 12 hours ago. "Commander," he said. The word hung in the air between them like static electricity before a lightning strike. Sarah's hand froze above the flag. She didn't move. She didn't respond. But something in her posture shifted, the angle of her shoulders, the set of her jaw, as if the sound of her real rank spoken aloud had fundamentally altered the physics of the space around her. Major Bradley walked to her table. His boots were wet, leaving prints on the tile floor. When he spoke again, his voice cracked. "Marcus keeps asking for you. He keeps signing your name over and over. He says you understood. He says you used your hands to talk to him while you were saving his life." Bradley's eyes glistened, but he didn't blink. "I need you to know what that meant. What you meant." Sarah looked at him across the table. She didn't speak. But her fingers slowly closed around the flag, pulling it back toward her chest. "The doctors said he couldn't be saved," Bradley continued. "All 5 of them. They said there was nothing to do but keep him comfortable. They'd already written him off." His voice dropped. "But you didn't know sign language could be taught in one night, did you? You didn't think about the fact that your hands were the last thing my son saw before you opened him up. You didn't calculate that your fluent ASL, executed during an emergency thoracotomy, would be the thing that made him trust you enough to survive." Sarah's jaw tightened. Not from pain. From understanding. She'd learned ASL in 2015. Afghanistan. A deaf interpreter named Hassan who worked with her unit had been hit by shrapnel during a convoy ambush. While waiting for his medevac, he'd signed her instructions to the medics around them, her orders converted to language, movements translated to meaning. It had taken her 3 weeks to become proficient. It had been a practical skill. A tactical advantage. A way to communicate in the dark. She'd never forgotten it. She'd used it during the procedure without thinking, her hands moving between sign and surgery, speaking to Marcus in the only way he could understand while simultaneously fighting to keep him alive. It had been instinct. It had been the blending of 2 identities into one moment of necessity. And now it was evidence. It was the proof that couldn't be explained away. "The hospital placed me on suspension," she said quietly. "I know," Bradley said. "That's why I'm here." He opened the folder and set it on the table beside the flag. Marcus's medical records. A full account of what happened in that trauma bay. The names of every medical professional who was present. And a statement from Captain Ellis, who's currently at Walter Reed, documenting the exact surgical technique you used and confirming that it was executed at combat zone proficiency levels. He paused. "You're not going to disappear, Commander." "Not this time." Sarah looked at the papers without touching them. She looked at the flag in her hands. She looked at the man across from her, a Special Forces officer who'd learned more about her in the past 12 hours than she'd allowed anyone to know in 8 years. "They'll come looking for explanations," she said finally. "Yes," Bradley agreed. "They already are." Through the diner window, Sarah heard it then, a sound that cut through the rain like a blade. Not a siren. Not a standard engine. The distinctive pulse of rotor blades, rotating fast and precise, cutting the night sky into pieces. The sound grew louder. Major Bradley's eyes didn't leave hers. He was still sitting across from her, composed and steady, but his uniform had begun to get soaked from the rain still dripping from his shoulders. "Your team is incoming," he said. "They've been waiting for the signal. They've been waiting since the moment you performed that procedure. Since the moment you decided to save a life instead of following the rules." Sarah didn't move. She held the flag against her chest and watched the rain continue its relentless percussion against the glass. In the distance, the rotor sound grew steadier. Closer. The quiet diner, which had been a sanctuary moments before, was about to become a crossroads. And the woman sitting at the table in the corner, the nurse who'd spent 8 years trying to be invisible, the commander who'd spent 8 years in exile, was about to discover that some identities, once revealed, could never be hidden again. The security guard at Cedar Creek Medical handed the envelope to the background check specialist at 8:02 a.m. on a Tuesday, and within 4 hours, the hospital's entire executive corridor was vibrating with a kind of controlled panic that only classified clearance flags could trigger. The specialist's name was Dorothy Chen, no relation to Sarah, and her face had gone pale the moment the sealed file opened. She made 3 phone calls in rapid succession. 2 to the hospital's legal team. 1 directly to the board chairman. By 11:13 a.m., an emergency meeting was convened in the conference room on the 4th floor, the one with the mahogany table and the view of the city that nobody looked at because they were usually too busy destroying someone's career. Dr. Prescott walked in at 11:28 a.m. wearing a golf shirt under his white coat, his putter still leaning against the wall of his office downstairs, his handicap a matter of record with 4 of the 7 board members sitting around that table. He smiled the way men smile when they know they've already won. He'd spent the last 72 hours building a case against Sarah Chen, the community college nurse, the night crawler, the woman who dared to exceed her scope and save a child's life without permission. He had documentation. He had testimony from residents. He had the weight of medical protocol on his side. And now he had what looked like classified government interest in her file, which could only mean one thing: she was being investigated. The smile on his face deepened. This was vindication. He didn't notice that Dorothy Chen kept her eyes on the door. Major Bradley arrived at 11:31 a.m. wearing his Class A uniform, dress blues with ribbons, the kind of uniform that makes hospitals go quiet. He wasn't alone. Behind him came a Navy chaplain in whites, and behind the chaplain came a Rear Admiral whose name had been redacted from the hospital's visitor logs but whose presence made the board chairman's pen stop moving mid-signature. Prescott's smile flickered. Just for a second. Just enough. "Gentlemen," Major Bradley said, his voice the kind of calm that comes from having made decisions that cost lives. "Madam," he added, nodding to the one female board member. "I need to correct something on your record." Dorothy Chen leaned forward. "The woman you're discussing," Bradley continued, "isn't Sarah Chen. That's her civilian name. Her name is Commander Sarah Chen. 4th Medical Battalion, United States Navy. Retired." The room went dead silent. Prescott's hand moved to his collar, a tell, a reflex, a crack in the facade. The chaplain opened a leather folder. He was a man in his 60s with the bearing of someone who'd stood over too many flag-draped caskets to be impressed by titles. He adjusted his glasses and began to read from a printed unit history, his voice steady and formal. 4th Medical Battalion, 4th Medical Group, deployed to Bagram Airfield, 2009 through 2017. Commander Sarah Chen served as battalion surgeon, responsible for all medical operations across 8 forward operating bases in Loga and Paktia provinces. Under her command, 63 surgical procedures in austere conditions. 0 preventable deaths. 14 soldiers returned to duty who, under standard protocols, would have been medevaced to Germany. Her team trained 217 Afghan National Army medics. She personally authored the battalion's trauma response doctrine, which was adopted by JSOC Task Force 121. Prescott's face had begun to drain of color like someone opening a door and finding the building on fire. The Rear Admiral stood. His name tag read Castellano, and his uniform carried 4 stars, the kind of stars that made civilians stop talking in elevators. He spoke without notes, because men like him didn't need them. Bronze Star for Valor. 2 silver stars. 2 Purple Hearts. The second Purple Heart was awarded after an IED blast that fractured 3 of her vertebrae and ended her active service at age 34. He paused between each medal. The staff members around the table are nurses, administrators, the hospital's chief of surgery, they whispered after each one. Not because they didn't understand medals, but because they were beginning to understand that they'd been sitting in a room with someone they'd underestimated. Her medical license, Castellano continued, remains valid in all 50 states. Her surgical credentials are current. Her security clearance, which you'll note triggered this morning's audit, is active top secret SCI. The clearance flag wasn't a warning. It was a notification that certain government agencies monitor her civilian employment. A man in a dark suit stood from the corner of the room where he'd been sitting so quietly that Prescott hadn't noticed him during the entire meeting. Intelligence officers have a way of occupying space that makes people forget they're there. His credentials, when he flipped them open, read 3 initials that everyone in the room recognized but no one would ever acknowledge aloud. Her classified call sign, he said, was Lighthouse. 16 operatives, that we know of, owe their lives to surgical procedures she performed under fire. 5 of those operatives are still in active service. 1 is sitting in this room. He nodded toward Major Bradley. Another is currently deployed to Syria. The government's interest in her file isn't investigative. It's protective. You understand? Prescott's hands had begun to shake. His jaw had started to work, but no sound came out. This wasn't supposed to happen. She was supposed to be finished. She was supposed to be small. The security guard who'd been standing at the back of the room, the same guard who'd handed Sarah her box of personal belongings 3 days ago, walked to Prescott's chair and set down another box. It contained his personal effects. A framed photo of his family. His golf ball awards. The nameplate from his office door. The guard's voice was flat, professional, and utterly without mercy. I believe you know the way out, sir. 6 months later, Major Bradley sent Sarah a photograph. Marcus was on a stage at his school talent show, his hand signing the ASL interpretation of the Star-Spangled Banner, his face radiant with the kind of joy that only children could manage, pure, uncomplicated, alive. Sarah held the photograph for a long time without moving. She'd been back at Cedar Creek for 5 months now, her name officially cleared, her clearance publicly revealed in the hospital's internal memo, her position reinstated with the title of Chief Trauma Surgeon. The board had offered her the role without a vote. Unanimous. She learned through former colleagues that Prescott had taken a job teaching CPR at a community college north of the city. The pay was $22,000 a year. He worked nights, ironically enough, showing people how to save lives when he'd spent years deciding whose lives weren't worth saving. His medical license was suspended pending a criminal investigation into the EpiPen diversion, a black market pharmacy scheme that had cost 16 patients their lives over 4 years. Sarah didn't feel satisfaction when she heard that. She felt something quieter. Something like closure. Something that looked, from the outside, exactly like nothing at all. She was back in the hospital's trauma bay on a Friday, her hands moving through their familiar patterns, when a new resident asked her to consult on a pediatric abdomen. Sarah pulled on fresh gloves, walked into the room, and began the examination with the same methodical precision she'd always used. The resident watched her work for 30 seconds, then said quietly, "I heard what happened." "What you did?" "I just wanted to say." "Save it," Sarah said, not unkindly. She didn't look up from the patient. "We have a child to focus on." The trembling wasn't fear. It was restraint, the old muscle memory of choosing what mattered most. The work. The patient. The next breath, the next heartbeat, the next chance to do something that meant something. That evening, as she was leaving the hospital, the barista at the coffee shop in the lobby looked up and said, "On the house," sliding a cup across the counter with a phone number written on the side. Sarah picked it up without expression. She almost smiled. Almost. She sat in her truck in the parking lot for 2 minutes, the coffee steaming in her hand, and allowed herself to think about what came next. The invisibility was over. Her name was known. Her history was official. She could walk away now, take a consultant position, work for the government, disappear into some classified role where Commander Chen belonged. Or she could stay here, in this ordinary hospital, in these ordinary scrubs, doing work that mattered to people who couldn't pay her what she was worth. She thought about Marcus signing on that stage. She thought about Major Bradley standing in that conference room. She thought about Dorothy Chen's pale face and the chaplain's steady voice reading her unit history like it was scripture. she put the truck in drive and headed back to Cedar Creek. The hospital doors slid open at 7:06 p.m. Sarah walked to the trauma bay. The attending physician looked up, and Sarah saw something shift in his face: recognition, respect, the subtle recalibration of hierarchy. "Commander," he said. "We have a multi-vehicle. ETA for minutes." Sarah nodded and began to move, her muscle memory taking over, her hands already reaching for the equipment, her voice already issuing instructions in the crisp, precise tone of someone who'd learned leadership in places where hesitation cost lives. The nurses around her responded instantly. This was different than before. This wasn't deference to a peer. This was trust in someone who'd proven, in the worst possible circumstances, that she could be counted on. The ambulance bay doors opened. The sirens grew louder. The night shift was beginning, and Sarah Chen, Commander Sarah Chen, the quietest person in the room, the one holding it all together, was exactly where she'd chosen to be. If you're enjoying this, please hit like and subscribe, it really helps the channel. And leave a comment letting us know where you're watching from.